for health professionals.
When people in the state don't have access to medical care, then essentially the whole community suffers.
Several bills filed by lawmakers aim to increase access to health care in some of the state's most underserved communities. Good evening and thank you for joining us tonight at 6 o'clock. I'm Bob Clausen.
And I'm Ashley Ketz. Healthcare concerns taking center stage today because health matters. KARK's Drew Petrimo looking into what this would mean for families all across the state. Drew.
Well, Ashley, Bob, it's an issue of access in some communities of this state. There are very few healthcare workers, creating a hole in the system. Allison Hester is a nurse practitioner working at Franklin Elementary in Little Rock.
Can you take some deep breaths for me?
She's been working in healthcare for underserved communities for the better part of 15 years.
It's one of Arkansas's greatest needs.
The pink counties in this map represent those where demand for healthcare professionals outpaces supply by more than 20%.
When people in the state don't have access to medical care, then essentially the whole community suffers.
Several bills filed during the current legislative session address what's called scope of practice, allowing healthcare professionals the ability to take on more responsibilities, like prescribing medicine.
When nurse practitioners, advanced practice nurses, are able to practice at their full potential, then access to care is only, made better.
Rhonda Finney is president of the Arkansas Nurses Association. She says lower reimbursement rates from insurance companies and government programs are another barrier to increasing health care availability.
I know nurse practitioners who have had to close their practices because of the lack of equity in reimbursement.
Ladybugs, do you think there are?
Hester says both urban and rural communities are negatively impacted by lack of access to health care workers. She hopes legislation will start to change that.
The patients benefits because they have more providers in their area that can provide care.
I spoke to a doctor today with the Arkansas Medical Society. He said more increasing scope of practice for nurse practitioners, for instance, doesn't necessarily mean more nurse practitioners will go into underserved areas. He says the best way to increase care in those places is to provide incentives to doctors to go there. Live at the Capitol, I'm Drew Petrimo.
Drew, thanks very much. And the governor fulfilling a campaign promise today, signing into law